Hi, everyone, and welcome to this webinar during Kidney Cancer Awareness Week with Jemma Falloon. I will let you introduce yourself and we can get started from there.
So my name is Gemma Falloon, and I will give you a brief outline of who I am and what I currently do. But before that, if I just go through a quick agenda of what it will look like. So understanding kidney cancer and recovery, challenges faced by kidney cancer patients when returning to work, supportive HR policies and legal considerations, and successful supportive workplaces. But before we get into that, I wanted to introduce myself. My name's Gemma Falloon, um, and 5 years ago now, almost to the day, I was diagnosed with kidney and thyroid cancer on the same day. To the left of the picture is my husband and my two children, who were 2 and 4 at the time. And to the right of that picture was Kidney Cancer Green Day in Chester, a couple of years ago when we lit Chester green. Um, it was important that I let you know that I am a kidney cancer patient, and that I'm not just one of those people trying to tell you what it should look like. I've been there, done it, had a half nephrectomy and then a full nephrectomy. And due to the way that I saw some people on the Facebook group being treated in work and other people when I went in hospital, I went last year and did my CIPD level 5, which is my HR qualification, so that I can support with grievances and policy and things like that. So, in the last 5 years, what have I been up to? I work currently for Mondelez, which is Cadbury's, which most of you will know. And we've set up a cancer support at Mondelez scheme. That is currently approximately 7.5% of our workforce is trained to be a cancer ambassador within the workplace. And next to that is the next two pictures after that, me talking at a grocery webinar to 1,600 people about the power of colleague-led support and wellbeing support for cancer patients. I always wear green, it's kidney cancer's colour, and you will always find that most of the time when I'm doing my talks, I wear green for that reason. The fourth picture along is another initiative that we have done at my work about disability and inclusion. We'll come into it later, but patients who have been diagnosed with cancer are covered by the Disability Discrimination Act. In February last year, I did an Instagram takeover for a global mental health charity, just to talk more about cancer, because people don't talk about it, or they are very scared to talk about it. Then the next picture along, you're not wrong, that's a pair of underpants. And that's got our cancer support logo on it. And I just wanted to tell you that the logo is green and purple because obviously I had kidney cancer and thyroid cancer. So the underpants were given to every male that worked for our business. We went to all 11 sites and spoke to over 2,000 men about testicular, prostate, and kidney cancer, so that they were aware of the signs and the symptoms, in the hope that when they pulled those underpants up, that was something that they reminded them to check themselves. Then the next picture is me at London Fashion Week. They were doing a catwalk for patients of cancer, and we all probably on this group sometimes feel a bit disgruntled because it's always breast cancer patients or bowel cancer patients. So I wanted to be there to represent the kidney cancer patients, and that's me doing London Fashion Week about a year ago. Next along is me doing a talk again at another mental health conference, talking about the importance of support for people going through cancer. And then the last picture was 2 global awards that I won, and I was presented them by Nikki Campbell for the cancer support work that I've been doing. I wanted to share those slides because I'm passionate that as cancer patients we can support each other, and that will be the biggest thing, the support that we can give each other. I also wanted you to know that I'm not just a HR manager sat here spouting policies and laws. I'm a patient, and I've been through what you've been through, and have experienced the things that you are possibly experiencing in the workplace. So the next lot of slides are as if we were talking to a HR manager. So these are something that you could use if you were trying to have a conversation with somebody at work. And there's me, London Fashion Week. I have a suprapubic catheter due to some complications, and it was important to me that I felt empowered as a kidney cancer patient to do that. So the next slide's understanding kidney cancer and recovery. So we all know what kidney cancer is, the treatment, and this slide is basically for managers, HR managers, to understand that no two people are the same. I could be a stage 3 and the next person next to me could be a stage 3, and the way that we're treated are very, very differently. Our health before, our mental health, the hospital we're treated at, there's so many things that could impact how you are treated or how you respond to a treatment or the mental side of it. So it's important as managers, HR managers, that we understand that no two people are the same. So there is no rule to how somebody would be. Somebody could be okay to go back to work after 4 weeks. Somebody, it might be 9 months. It's very individual to the person. And there's a massive amount of physical effects, but also emotional effects too. So fatigue, pain, surgical site. I'm sure we've all been there. It's a robotic surgery. Oh, I'll be fine. I'll be up and about. And then you try and get out of bed with it going through your abdominal wall, and you realize it's not going to be quite as easy as you thought. But a lot of kidney cancer patients report chronic fatigue, and it can persist for quite some time after daily activity. And emotional effects. Many of us are in fight or flight mode. We go on that emotional roller coaster of, oh yeah, everything's fine. I need to do what I need to do. I need to have my operation. I need to get my results. And actually, when you sit back after that time, that's when the emotional effects can take place, or they did for me. Some people ride that roller coaster and are fine, and others just need a little bit of help along the way. But that doesn't make one person better or worse than another. So typical recovery timelines, I found these online, and again, everybody's very different. Most people are very different in how they heal, but I think a lot of people are quite surprised to that this isn't just a as a lot of workplaces think, go in, have the operation, recover a little, and then go straight back to work. Actually, there's a lot of things that can impact how you are as a patient. So managing workplace fatigue, 50% of patients report persistent fatigue months after the treatment or surgery, and enable energy. Oh, I don't know where that's come from. And you should schedule breaks in. We'll go into it a little further along, but it's all about those really open and honest conversations with your manager about what you can and can't do. So addressing the emotional impacts. Your memory can be bad. We've got enough scans to remember, MDT meetings, who's your nurse, when's the surgery going to be, or even after surgery, trying to remember when your next scan is. And then along with that comes the scanxiety that we all get. So actually, there is a lot of attention and memory problems that can occur. Rehabilitation. If you have that as an employer, that's a wonderful thing to be part of. I initially thought, oh, I don't need any help. I'm fine. I'm all the way through it. But then going back and actually seeing that I was struggling a little bit after that, what had happened allowed me to support myself and my family emotionally. Emotional challenges, anxiety and depression reduce concentration and limit social interactions, so it impacts workplace performance. We all know when you first get your diagnosis that the anxiety can be really high, and it can cause some people to have depression. But the impact on doing this right in a workplace would mean improved concentration, social engagement, and productivity, foster successful workforce reintegration. integration for patients. So as a workplace, knowing that those people, you're looking after them and you're supporting them, allows you as a business to grow as well. You haven't got somebody off sick. You've got somebody who's invested in the business and wanting to get back to work. That doesn't mean that you want to come back to work fast. It just means slowly and being treated and looked after very well. So navigating medical appointments and flexible work needs. We know that at the beginning that it's appointment after appointment after appointment, and then it's pre-ops, ops, after ops, injections, and then there's the scans that come with it afterwards. So just regular follow-ups and managing long-term side effects often require time away from work. And without a flexible option, employees risk lost income, burnout, or job insecurity during recovery and the time afterwards. Effective flexible arrangement, remote work, adjusted hours, and condensed work helps employees attend appointments and manage symptoms while maintaining productivity and continuity of care. How many times have you said, I've got an appointment, oh, you're going to have to take a day's holiday, or oh, we can't accommodate that? Actually, if we accommodate our people to be able to do those things, it is shown that they give as much back as we give them. And then the outcomes and the recommendations. Survey links supportive scheduling to higher retention and satisfaction amongst cancer patients. We recently did a survey about how the support had it kept people in work and had it supported their mental health. And actually, we were in the 90s for how supported people felt when going through cancer treatment. So under the Equality Act 2010, employees diagnosed with cancer are legally protected as disabled, entitling them to reasonable workplace adjustments and safeguarding their rights against discrimination. So what is the best practice for reasonable adjustments? An assessment with an occupational health professional, and this shouldn't be done by a manager who thinks that they know what kidney cancer should look like. It should be done by a professional who that is their role, so that we can protect and look after those people. A collaboration, it should be between a manager and the employee, and there's no, oh, let's meet each other halfway. If you're not ready to go back, there's no meeting each other in the halfway. Or if you are ready to go back, it's about letting your manager know that you are ready to go back, and that's what it looks like. Communication is key. Keep open, ongoing communication between HR and managers and employees to address any concerns and adjust accommodations as needed. So for me at the beginning, I really struggled with knowing, would I still have a job? Would I get paid? Would I still keep my company car? Would I still have the role that I had? And none of that was on our intranet for me to have the answers to. It then went to our employee relations team, who then supported me with the answers to those questions. And that's where the Cancer Ambassador Scheme grew from. Regularly review and update accommodations to ensure continued effectiveness and support for the employee. It doesn't mean that we're 6 weeks in and we're meant to be at 80% working. If that person's not ready to go back to 80% working, we have another conversation about what that would look like to see, and constantly review. Just because we say something doesn't mean that it's set in stone. As we addressed earlier, most people are not aware, or people react very differently to how they thought, how their consultant thought, or very different to somebody else that they knew. So confidentiality, communication, and supporting employee well-being. Confidentiality is key. It protects dignity and it builds trust. And we have very open communication. We have employee initiatives, mental health resources, peer groups, and wellness programs boost morale and reduce absenteeism. And culture and retention, as support significantly improves long-term retention. So the two things that you can see on the screen there are the employee guide and the manager guide that we set up at my place of work. we already know, for most of us, cancer is a postcode lottery as it is, and I didn't want there to be a excuse me, a lottery of how people were treated within the business. So we put these guides up so that people knew what the bare minimum to expect from us as a business, to ensure that they were looked after. Also, as part of that, we do some training. We've trained over 250 people to be cancer ambassadors, and these cancer ambassadors are just there to listen or guide or support people not just going through cancer, but their friends and their families. We currently have supported somebody whose dad was going through a chemo, and she had high absenteeism because she was worried about him getting there and getting home, and she would phone in sick because she was worried about getting out of the car park. So what we did she got a parking space at the front of the car park. It was easy, simple, and she came back to 100% attendance. It was a really tiny thing about moving the car park space, but it was something that meant a lot to her and didn't cost the business anything. So what does a successful and supportive network look like? So peer support initiatives, create networks or buddy systems for returning cancer survivors, not keen on that word, but patients to connect, share experiences and offer mutual support, reducing isolation and building belonging. And there's no better people in the world to set up those initiatives than cancer patients, because you've been there, done that, and many of us, having seen the posts on the Facebook group, want to support each other. We all wish we had somebody when we got diagnosed that told us the things that we now know as cancer patients. This isn't something that needs to start off as big as ours did. It certainly didn't start off big. It can be something very small where you just meet once a month and people are able just to talk to somebody who got it. Dialogue facilitation, normalize conversations on health and work challenges via regular check-ins. Have one-to-ones with your manager, or if you're a manager, have one-to-one conversations with your team, because we don't know, your team might be on the two-week fast track, and that might be why their work has slipped, or they have got more appointments that you're aware of. So open and honest dialogue facilitation. And cultural impact strategies. This doesn't just impact, for me, a typical white female. It impacts people of, I suppose it's the one D&I that will impact everybody. Cancer doesn't care what colour you are, who you love, if you're neurodiverse, it doesn't care. So we need to tailor sometimes our approach to cancer to the people that we're talking to. From the work that I've done, you have to be very careful speaking to people from an Asian background, because it's not always something that is traditional in their culture to talk so openly and honestly about it. So you have to be very mindful of that. My eyes were opened to the fact of people getting screening who are trans and how that might make them feel. So it's all about the culture and the impact that may have on your yourself and your workplace. So the conclusion that I've come to, and I've done this training over 20 times. I've spoken to possibly over 10,000 people about cancer in the workplace. We need to recognise that recovery is a variable. No two people are the same. And I know I've said that 2 or 3 times, but you cannot put two people in the same box, and never say that to somebody either. How frustrating as a cancer patient is it sometimes when someone said, oh, so and so, when they had this is what happens. No, I'm me. This is me and telling you this is what I want and what I need. Support physical and emotional health. Don't rush somebody back to work, or don't rush yourself back to work if it's not the right place for you to be. And then implement compassionate HR policies or guidelines. Not many businesses now like to have policies due to the changing laws, but guidelines can be a great thing to allow people to be able to look at things that they sometimes don't want to ask the questions about. And then peer support and wellbeing programs boost success. We have it's the number one wellbeing for us as a business. We're about to go into Northern America, which is used. Then we'll go into South America. Then we'll go into Australasia. And that's just from me. I'm pretty low down the pecking order at work, but that was from me saying, when I was going through this, I didn't feel I had the answers, or I didn't feel I had the support that I wanted. So what can we do about it? And that's where this has grown from. So don't be afraid to reach out and ask if there's something that you can do within your workplace. If you would like to, before we go into questions, I've left a bit of time because last time we had quite a few questions. You can contact me on my email address if you wanted to look at how this can happen for you at work, or you've got some ideas, just give me an email. I've got my own cancer support work page where you can have a look at what I've been up to. And then there's some links there to if you business is like, yeah, we're not sure if it can happen, those links will show them that what actually will happen if you support your colleagues, your workforces, about better, stronger guidelines and support for people with cancer.
Perfect. Thank you so much, Gemma. I hope that has enlightened people on what they can expect when returning to work after a cancer diagnosis. I know it can be an extremely hard place to navigate, and you've got so many things going on in your head, and hopefully Gemma and the work that she does can help everybody implement any policies that need to be introduced into their workplace. So thank you so much, Gemma. As you said last time, I know last year when we did a similar webinar, I know we had a lot of questions, so we've got some questions coming in now. So I'll just dive straight in if that's okay, Gemma.
Yeah.
Perfect. So first of all, we've got one here, and it says, I haven't actually returned to work yet after after my cancer diagnosis. I'm not too sure what to expect, and I feel overwhelmed at the thought of starting again. Do you have any tips on how I can talk to my manager on how to reintroduce myself into work, and still get support I need?
Yep. The first thing I would say is I used to have monthly catch-ups with my manager that allowed me to stay within the team and within the business. So you might, before you want to go back, maybe have a Teams call with your team, or maybe if you feel up to it, I don't know how far you are out, go for a coffee with a colleague, just catch up and see how that feels, because it can feel quite isolated when you come back, and then when you walk through that office door and everybody turns to see Gemma's returned to work, it can be quite overwhelming. So maybe see if there's a couple of people on the team that you can speak to before.
Mhm. Don't
Is
worry,
this
Gemma,
the
I'll read
same
those out.
person that?
I'll read those out, Gemma.
Sorry.
Don't worry. It's okay.
Um, so I would say try and get, before you go back, try and speak to your manager, or somebody from your team, so that you can catch up on the office gossip, and it's not that much of a problem when you don't feel as isolated. I would say going back, you just need to be very honest with your manager,
Mm,
and let them know what, I don't know what role you do, but if it's an office role, actually sitting there for 8 hours isn't very good for my scars, or needing to go to the toilet to keep myself hydrated, that I'm hydrated, and drinking lots of water, taking pain meds if you're still in pain. It's about an open and honest conversation with your manager. And unfortunately, if your manager's not a, somebody that is supportive or approachable,
mm,
I'd suggest you go to occupational health if you have that within the workplace, because they're the people that are there to protect you. They're the people that ensure that you don't return to work too early, because they don't want you having an accident at work or injuring yourself and being off for longer. So if you don't, or if there's somebody else in the business that you can talk to, you can't. We found that women didn't always want to talk to men about cancer, and men didn't always want to talk to women, depending if it was breast or testicular. So find somebody that you can speak to.
mhm. Perfect. Thank you, Gemma. We've touched a little bit on there. So we've got another question here, and it says, my boss isn't very supportive or approachable. How can I have these conversations with them as there isn't any external help as it is such a small business?
Okay. Um, ooh, good one.
Stump.
Yeah, there's a there's lots of support out there. I think it depends which hospital you're at, which part of the country you're at. There's lots of where I am, there's a Maggie Centre, so they were very good to me and my family when we were navigating everything. Um, if you go onto ACAS, they're the law, they're the conciliation experts for HR. They can tell you what good should look like, and you can go in with a list of what good should look like. Don't sell yourself short. Maybe say that the support isn't there, and you it's something that you want to look at in the future, how you can support other people. But yeah, it's so tough when you're a small business. I'm very fortunate. We've got 4,000 people in the UK, so we have
Yeah.
we have outside help, whereas that's not always available. I
Mm.
think without getting, because we all get flustered, don't we? And I want to tell them this and I can't do that. And it's go with a list as you would your consultant. When we all find out, we have that list of questions, don't we? What's the staging? What's the prognosis? When will this happen? Go to your manager with those questions as well. I'm
Mm.
returning to work and I need X, Y, and Z. Can you do X, Y, and Z? I've got an appointment on this date. Can you put it in my diary? And I think sometimes you just have to have that list so that you don't go off track, and it allows you to ask those questions.
Yeah, completely. I think it, yeah, I touched on there. So it's humans supporting humans at the end of the day. So we hope that everybody will be understanding of what you're going through. So no, great points. And on that, Gemma, do you have any tips or tricks that may help somebody who is returning to work with, the anxiety of returning to work? What did you do when you returned to work? What helped you get, navigate that difficult time?
Yeah, I think there's two very different people. I wouldn't say I worked all the way through because obviously I had an operation in the middle and I was on morphine for a while, so I was banned from my laptop for a while. But for my own mental health, I worked a lot and I was able to do that from my laptop at home. And I know that's not always possible
Mm,
for some people. I know the people that went off work and then came back. They did kind of when you're on maternity leave, and they just did some keeping in touch days so that
yeah.
it wasn't a big jump into being off for 3, 4, 5 months and then straight back into work.
Mm,
I also I sent an email to my team, so it wasn't a million questions when I returned to work. Everything was in the email, and I didn't feel overwhelmed by all the questions. I also used to send a bit of a blog to them once every couple of months, so they knew what had been happening, so that the contact was still there. But it can be, especially I suppose if you've got a physical job and you're returning back for the first time in such a long time, to go and have that conversation. Maybe have some keeping in touch days.
yeah, it's a really good idea. I think that's a really, really good tip there. We just have one more question here. It says, what happens if I'm offered an alternative role within the company and it's a role I don't want to go to? So I assume maybe like you're saying if you were off and maybe they gave you a different role to ease you back in or, something like that. But it'd be good to get your perspective from a HR point of view.
Yeah. Um, I guess that alternative role would depend if you've asked for what you've asked for, and if it's because of the cancer, then 100% no, they can't. You're
Yeah.
covered by the Disability Discrimination Act. If this is something that you've asked to go to 4 days because of the fatigue, and the business have reasonable um, reasonable reason to decline you going into your current role, then they can refuse it. But if this is they're offering you an alternative role because you've been off and you're going back, no, they can't.
Yeah.
They certainly can't.
Yeah, I think of stuff like that. It's being able to advocate for yourself, isn't it? And know what's right and what's wrong. And sometimes when you're maybe in a bit of a vulnerable situation, you don't want to do that. So yeah, really
Yeah.
great tips there. Thank you. We've just got one more question. I think we'll finish on this one for this evening. So it's can GPs help with occupational health assessments? As my job doesn't have an occupational health department.
Your GP can do a fit note and say what you can and can't do.
Hmm.
And your GP would also have all your medical records in front. I would say your GP would be a good place to go
Yeah,
if you don't have an occupational health
yeah.
department. Um,
I think
Maybe
that when
your nurse if you've got one.
yeah.
Um, Not all of us have cancer nurses. Your nurse if you've got one, they're very good at knowing different people in different situations. So don't be discouraged because you don't have your own occupational health department. The ACAS website is a good website to go on to look at legally what reasonable adjustments are. And don't forget, you will have protected characteristics, and your protective characteristic will be the disability of cancer, and that just doesn't go away after the 5 years that most people think it does. If you've still got fatigue or you've still got a hernia due to incisions, or for myself I've still got my tube and that impacts my daily life, that continues as a protected characteristic.
Perfect. Well, thank you, Gemma. I hope everyone found that insightful and they've managed to collect some tips from tonight's webinar. But as Gemma said, and she shared her email address, if anybody has any details, they can reach out to Gemma. And also they can reach out to Gemma via us, Kidney Cancer UK. But we will also be sharing this webinar as well on our website, so you can take any details as well. But thank you so much for joining, and I hope everybody has a great rest of their week and enjoys the rest of Kidney Cancer Awareness Week as well. We are definitely nearly in the midst of it all now. Tuesday evening, so we're spreading as much awareness as possible. And as we all know, it coincides with World Cancer Day tomorrow. So that will be fantastic to see what the government has in their cancer plan. So yeah, thank you so much everybody for joining, and have a lovely evening. Thanks.